Thank you for being here. Let me know if you could hear me. I really hope you can. That's always the scariest part. It's like, will they hear me? Um, I see a few people here already. Hello, Alan. Hello, Ben. Hello, Ronford. I'm so happy to be here. Okay, let's just like housekeeping. Let's get everything ready. I have a little bit of allergies going on, so if I sound like I'm crying, I'm not crying. I'm just trying to breathe. Oh my goodness, we got hello from the UK. I feel like it's so funny. Patsy Lee, one of my longest followers here, is from the UK, and I believe Patsy's in the US right now. So funny that I always tend to do these when we're both in the US. Anyway, thank you it's 1 a.m. Trinity, thank you so much for being here. I'm a night owl, so that's my life, but I hope you're a night owl too. And if you're not and you're just here for the teeth, either way, I'm so happy. Mr. Rainbow loves coffee. Hello. Hey, Michigan, close to me. We're in Chicago over here. This is Chicago, Michigan, Midwest. What's up? Hello from Kentucky, another Midwest. Look at our Midwest friends. I always try to pick a time that kind of works for as many time zones as possible. Time zones, it's so hard. I think I'll have to do a weekend in the future. I've been saying this, but I'll have to do a weekend where I could do the morning here because then I won't be at work in the US. So then Europe, y'all don't have to stay up till past midnight, you know? So hopefully I'll figure that out soon. Patsy just said something, it's like a tradition. I had to join live on vacation, but this time I'm on the East Coast. Even better. Thank you so much for being here. I wasn't sure if you'd be here. So, hello everyone. Now that we're kind of settled in, I want to say thank you again for being here. Thank you all if you're a subscriber. Thank you if you just like are scrolling through on YouTube. Thank you. We're here to talk some teeth today. I'm welcoming any questions you have, whether it's dental health, generalized questions. I can answer general questions about dental health. I can also answer anything about the dental hygiene career or schooling or, you know, anything like that. Anything random you want to know about YouTube or I don't know, any questions, I'm here. So I love how, Giselle just said, we obviously all care a lot about our teeth to be here. It's true. How cool. So whenever I tell someone, like they ask me what I do, you know, and I'm always hesitant to talk about having a YouTube channel, but if I bring it up and I try to like explain like, because, you know, YouTube can have such like a stigma still to this day. Like, oh, what are you doing on YouTube? Like silly, wild stuff, you know, which isn't bad. I'm all for the silly, wild stuff. But I just always try to make it clear, like I'm more of like a dental health educator. I'm a healthcare communicator. I'm not like doing too the silly of stuff. However, side note, I am doing something very silly soon. I'm doing a parody to Lady Gaga's Abracadabra. And I'm going to give you a little sneak peek in just a second. But anyway, so what I do is very, you know, educational. And I always tell people like, isn't it so cool that this many people are just like me and want to know everything they can about dental health? Like we have a whole community that cares about teeth. I don't know. I think about it every day and I'm like, wow, this is so cool. Okay, sorry, I got sidetracked and I did not look at any of the comments. I got to scroll past. Oh, and then I was going to tell you, so bleeding, okay. If you know Lady Gaga's Abracadabra, let me know. And don't worry, and then I'm going to scroll into the questions. Lady Gaga's Abracadabra is like abracadabra, abracadabra. You know how it goes. So mine is going to be, this is a reveal. I haven't posted this anywhere. It's going to be bleeding gums means you need to floss more. If someone copies me within this next week, we will know. I said it here first. No, I don't think anyone's going to want to copy me because it's weird and actually probably not even. But I'm obsessed with it and I can't wait to share it all with you. I'm going big on the production. Okay, anyway. Okay, so now that you know about fun, we can have fun. You know what is that? Work hard, play hard. I believe in that I believe in that. Like to the fullest. Work hard, play hard. We got to have fun. Dental health awareness and having fun with dental health is just as important as dental education, you know? Just making teeth talked about. If someone comes across bleeding gums, my bleeding gums video because of Lady Gaga, and they think, oh, maybe I should floss my teeth tonight. That's where it's at, right? Okay. So let's see. Oh, someone is from Chicago. Hello. Okay, so what kind of questions we got? Uh-oh, someone said, Everyone give Whitney's live stream a like. Only 6 likes so far. We can do better. Thank you so much, Alan. That's so nice. I'm so bad at like promoting, right? Like, I don't know. Yeah, I press like. I love it. Thank you. I know there's always these like, these gifts or these like, there's all these extra things you can do. And I'm not sure where they are. I always forget. I was supposed to look this up before we started. But there's like super chats. I think that's something. Super chats. There's all these cool things. So thank you so much for your support. Okay, let's go into the questions. Question number 1. Okay, someone asked, can you do a full dental cleaning appointment video like the whole appointment? I have I've done, good question, BMS Racing. I did a while ago where I did like a POV where the like camera was on me the whole time instead of the patient since it was the full appointment. But good idea. I'll have to do another one of those for sure where it's like the whole appointment. So what else we got here? What's my favorite part of a cleaning? Oh, patient education, 100%. When I could tell a patient a fact they didn't know, or I can help adjust how they're flossing because maybe they haven't been flossing the best way, and that like light bulb clicks in their mouth, or in their mouth, that light bulb clicks in their head. Obviously, I always got mouth and teeth in my mind. When they can be like, wow, you just taught me something I had no idea. That is the best for me. Nothing can be better than like helping someone change their lifestyle, right? For the better. Okay, what else we got here? Is it possible, Mr. Rainbow loves coffee, is it possible to heal an old root canal that's cracked on top and possibly something happening below that? This sounds, okay, so root canal questions like that, this is very specific. Heal an old root canal that's cracked on top. So oftentimes when you get a root canal, so hopefully this will answer your question. When you get a root canal on a molar or a premolar, not the front teeth, but the back teeth, you will need a cap over it or a crown, right? You need to cap it or crown it because now that tooth is not as strong because you went all, you kind of messed with the foundation, right? So you need to cap it to make it strong so it can last. So my biggest question would be, are you talking a front tooth or a back tooth? If it's a back tooth and it's cracked, that must mean the crown is cracked and we have other problems to worry about, right? Maybe it's just the porcelain, maybe it's not the tooth. But if it's a front tooth that's cracked, because sometimes when you get a root canal on a front tooth, you could just do a bonding. There's just so many variables to answer this question simply. I guess my most simple answer is yes, there is something called a root canal retreatment, where if it's reinfected or there's something wrong with it, they could go back in and clean it out. There are ways to fix a root canal. There are, like a retreatment. But the best way to find out for your individual mouth is to get an x-ray of your tooth in question and to talk to your dentist and or a specialist, an endodontist, to see what they can do for you. It's not out of the question. It just depends on so many factors. Like I said, back tooth, front tooth, is there a crown, is there not? I hope that kind of helped. My goodness. Annalise, thank you. Or Annalise, I love it. I love that. I'm going to press heart. Thank you. I didn't even see what you asked yet, but you gave me a very nice supportive donation. Let's see. What makes you stand out in hiring as a hygienist? Okay. Okay, I love it. So that's a good question. So I'm thinking, like if you're trying to get, sorry, I keep playing with my hair. I just can't stop touching my hair. Okay, so what makes you stand out in hiring as a hygienist? I would say right now there's such a hygiene shortage. I'm just going to be real with you that just be yourself. You know what I mean? They need hygienists. So don't have so much pressure on yourself right now. More than anything, they need to hire hygienists. So I don't want to say it's like easier to get a job nowadays than usual, but just keep that in mind. Maybe that'll help your stress level when going into a job interview. Know that they want to hire you. So just don't give them any reasons not to want to, right? So having said that, if you still want to stand out, yes, there might be some offices, every area is different, that maybe are more competitive than others. If you really want to work in perio, or if you really want to work in an orthodontic office, for instance, like hygienists, that's more rare to get a job at an orthodontic office. Again, this is very generalized. There's always going to be situations where it is or isn't. But I would say what makes you stand out is really communication. and being yourself and discussing. They know you're a good clinician. You passed boards, you graduated, right? But now they want to know how you're going to be with their patients. Are you going to be friendly? Are you going to be nice? Are you going to be clear in communicating? So that's my best advice is, of course, be yourself. And if you're on the shyer side, that's fine. No worries. You don't have to be the most outgoing person. You just need to be nice, and you need to be clear and make it clear that you're going to make your patients comfortable. I think that every dentist I've ever talked to tells me they're never worried about your skills, but they're worried about how you're going to be with the patients. So I hope that helps. Take that with, that's my perspective. Everyone's perspective is going to be different on that answer, but I hope that helps. And also I do want to say, let me see, how do I get into here? I do have a job board. I believe, yes, Teeth Talk. It's jobs.teethtalkgirl.com. So if anyone's out there looking for dental hygiene jobs, there's some really great jobs on my job board. Again, that's jobs.teethtalkgirl.com. Can I type that? Oh, thank you. It's typed in there. It's right there right now. jobs.teethtalkgirl.com. So if anyone is looking for any jobs, go get it. Be yourself. Bring to them the amazing energy that you already have, and you're going to get that job. And if you don't get that job, it wasn't meant to be. You know what I'm saying? So I'm wishing you the best. And I hope I kind of answered your question, Annalise. Okay. Oh, we got a yellow one. Thank you so much for your support, Mr. Rainbow Loves Coffee. Thank you very much for your wonderful answer. I have been speaking with my dentist about this. You didn't give me a chance to talk about, he didn't give you a chance to talk about redoing your root canal. He only said about the implant. Okay, good question. So here's a good statement and good knowledge. So, of course, I'm glad that my answer kind of helped. So yes, if he's going straight to implant, usually that means there's not enough healthy tooth structure left to redo the root canal, right? So they don't want to waste your time and money to redo the root canal if it's a low percentage of it working. So I hope that piggybacks on the answer I already gave. If someone's jumping into a root canal, there's a good chance. If someone's jumping into an implant, extraction implant, there's a good chance they don't want to waste your time trying to redo the root canal. But it's always good to ask. Ask for percentages. I always say, what would you do if this was your tooth? That's something I always tell my patients to ask the dentist. If I have a patient who's talking with me, because, patients often talk with the hygienist, undercover. I feel like patients are always well, what do you think? And I think that's so cool that we got that relationship. So anyway, I'll always tell my patients, when the dentist comes in, ask him or her, what would you do if it's your tooth? So I feel like that always helps. And I say the same thing with hygienists when patients are a little, I don't want to say hesitant, but nervous about getting a deeper cleaning or we call a scaling and root planing periodontal therapy. If you need something more than just a routine cleaning and you're hesitant, ask the hygienist, what would you do if this was your mouth? And they will always give you a genuine answer. And that's the answer that's best for you, right? Okay, so I hope that helps. What should I know before I get my braces off? Buffalo Nation. Okay, first of all, exciting that you're about to get your braces off soon. Go you. I don't know how long you had in braces, but it's so exciting that you're about to get them off. So I will say, I don't know how soon you're getting them off, but the best thing to know is to keep them as clean as you can throughout your braces journey. So then when you get them off, you won't be surprised on any cavities or white spots that might have happened under the brackets. So what you should know before you get your braces off really, really is, I hope, and if you didn't, it's okay, but if you really, really want to just keep your teeth as clean as you can throughout your braces journey, you won't need to know anything for getting your braces off other than, when you first do that, they're going to feel so smooth once you get your braces off and you're like, oh my goodness, they're so smooth. Be ready for that amazing feeling. And then also be ready to wear your retainer every single night. If they don't give you permanent retainers, if they give you removable in and out, be sure to wear that every single night. Or sometimes they even have you wear it for a month or two all day. And then they graduate you to at night. So just listen to their recommendations, their advice, and give me 1 second. I just have to blow my nose. I'm so sorry. Hold, please. Everyone, I'm getting out of frame so I don't have to gross you out. We talk about teeth enough. We don't have to talk about ENT nose issues. Okay. Oh my goodness. Who is this? Ian? Ian. What is this? I'll be back. Let's celebrate their first super on a live stream. Ian, thank you so much for your support. That was very nice. That was so nice. Thank you all for these super chats and these super questions. All of your questions, just being here. Thank you so much. Okay, sorry. Allergies. Usually I do this for an hour, but I do feel, not to gross anyone out, but we all like healthcare here. We're all in, I'm not going to gross you out that like everything's draining down my throat right now and I'm like, ugh. So anyway, I might have to cut this one a little shorter than normal. So let's just chit chat for like 10-ish more minutes. I'm going to answer as many questions as I can. Okay. Thank you so much again for everyone here. Oh my goodness. Anyone else? Raise your hand. Allergies, post-nasal drip, please tell me I'm not alone. Please tell me I'm not alone. Okay. And then as that, I have to, ooh, Patsy, thank you so much for being here. They told me I have to wear my retainers full time for the next 6 months. Can't wait for nightly. So there you go. That's such a good reason to, or that's such a good thing to bring up. Everyone's journey, their braces journey is going to be different, right? Some people will need to wear their retainers for 6 months straight, where others might be told 2 weeks. Like, it just depends. One person's advice isn't better than the others. Everyone just has such a unique mouth and dentition. There's so much that goes into it. How long you had them on, how much movement your teeth actually had to do, your bite, your occlusion, whether they had to move your teeth forward or backwards. There's so much that goes into it. So always just trust your orthodontists or your dentists if you're doing Invisalign. Always trust their recommendations for your individual mouth. And I love hearing everyone's stories because, yes, it does help give people an insight or an inkling into what they might have to go through with their teeth. But remember, nothing's a one size fits all. Oh my goodness, someone from Korea. Hello. Thank you so much for being here. You know, I did Taekwondo in college, and I know the numbers 1 through 10 in Korean. And I always try to I think of any reason to try and say those numbers with my patients. And I have a few patients that speak Korean and I'm always like, hey, can I practice my numbers? I'm just so proud. I love languages. I also know 1 through 19 in Polish. I know 1 through 100 in Spanish. I love, you know what I mean? Like, if I could count someone's teeth in all the different languages and the numbers, especially if it's a child who their first language is not English, I'm so excited to try and count in the other, in the language that person speaks. I love languages. So anyway, I just don't want to embarrass myself, but I will say, Hana, do, set. Tell me I was okay. Okay, so also one thing about languages, my grandparents were Polish and my grandma used to, teach me a little bit of Polish. And anyway, I'm always so proud and I'm always like, I speak Polish, even though I don't. And when I say anything in Polish to my friends who actually speak Polish, they're always like, okay, you sound like a 4 or 5-year-old, but it's okay. And I'm like, I'll take it. At least you can understand me. Anyway, okay. Oh my goodness, Ben, not a question, just letting you know, next Wednesday is the day I'm getting my wisdom tooth evaluation with an oral surgeon. Okay, get it. I'm so proud of you. I have so many patients who we've been telling it's very hard if you have any kind of dental anxiety to do that first step in getting that evaluation. I don't know if you do or not have anxiety, but that is just such a nice thing to share to help inspire and motivate others to get that oral surgery eval, because the consultation or evaluation, whatever you want to call it, they're not going to do anything to you. They'll take an x-ray, they'll check out your teeth, they'll let you know what to expect. It's a great appointment. Do it. I recommend it to everyone. If you're scared to get your wisdom teeth out, no worries. Just at least do that first appointment and they can calm your nerves and tell you what's going on with your individual mouth. And you don't have to schedule to get them pulled right away. At least now you're educated on what's going on in your mouth, So thank you for sharing. That's such a great thing. Oh my goodness, Zach B. Okay, had my cleaning today, picked bubble gum for the polish and strawberry varnish. You are the rock star of teeth YouTube. Thank you for all you do. Oh my goodness, Zach. Oh, I'm pressing hearts on these. Thank you so much for sharing that. And I'm with you with the strawberry and the bubble gum. I love it. Keeping your teeth clean. And thank you so much for, again, following. I know I keep thanking, and I'm sorry, my nose is running, and we're going to be okay. Okay. Are you a yoga master? No, I wish. I am intermediate at best. I can do some advanced poses, but like not very well. I have to cheat. I don't want to say cheat. I modify, right? Yoga is a practice. There is no destination. It's all about the process. And yoga makes me feel good every day. And yes, okay. So thank you for listening. Can you talk about the shame of having yellow teeth? Mia, no. Okay, yes. I feel so bad when people are so worried about the shade of whiteness of their teeth, right? Because I have a video about this, but I'll just recap it. Long story short, white teeth does not equal healthy teeth, okay? I have so many patients with super white teeth who are struggling with cavities, who are struggling with gum disease. So just so you know, white teeth, although cosmetic, it doesn't mean you have healthy teeth. Whereas I also have a bunch of patients who have like a naturally darker shade of enamel. Their enamel isn't perfectly white, but they've never had a cavity in their life. Or they've never had any gum issues. Their gums never bleed. And so don't judge a book by its cover. It's all cosmetic. Some people just have thinner enamel than others. And when you have thinner enamel, they're just harder to whiten. And it's easier for the dentin, the next layer, to show through. My front teeth are like a little whiter than my back teeth. If you look back there, they get like, oh, sorry. No, you're not going to be looking at my nose right now because my nose has been running. Okay, I'll do it in another video. If you look back, I'm like, how do I hide my nose? If you look back there, my teeth are kind of just naturally yellow back there, and that's fine. They're healthy. So I hope that helps you a little. Just like, you know. Oh my gosh. Oh my goodness. What's this? Ah! Oh my goodness. I almost reported someone. I don't want to report anyone. Everyone's so nice. I'm so sorry. Okay. Excuse me. Oh my gosh, there's so many questions. Oh my gosh, someone asked nursing versus dental hygiene. Janice, great question. I will say I have a YouTube video all about nursing versus dental hygiene and the two occupations and careers and schooling and everything. So if you want to search that video, just type nursing, dental hygiene, teeth talk girl on YouTube and it'll pop right up. And that goes for any topic. I'm very proud of having a pretty comprehensive catalog of almost every dental and oral health topic there is. Say you have a question about canker sores or cold sores, just type canker sores, teeth talk girl, canker sores, teeth talk girl in the YouTube search and it'll pop right up. You can also search it on Google. Even better if you do it on Google because then Google will like be happy that people are searching about me, right? So if you want to type it in Google, canker sores, teeth talk girl on Google, and then my YouTube video will pop up there or my website. I have articles. I know most of you here are watching a video, so you probably like videos, but maybe sometimes you just don't want to like hear me yap and talk. That's fine. If you just want to get a quick answer reading it, I also have a website, teethtalkgirl.com, and it has every single one of my videos in article form. So if you just want to scroll and get the answer real quick, you could check it out on my website as well. And I really am doing this all just to help expand like access to knowledge, access to dental health information and education, and access to accurate evidence-based information. Most of you who have been following me know that everything I do is evidence-based, and I really, really am passionate about making sure nobody does anything at home that causes irreversible damage to their teeth, right? You all remember the nail files on teeth. That was a thing. It was trending. So many people saw it on TikTok and whatnot and tried it and then like ruined their enamel forever. So I just have such a passion to spread evidence-based dental health information, and I'm so thankful you're all here to help me spread it, because every single person who subscribes or presses like on this right now, thank you for pressing like. If you're here, please press like. You're helping others learn about dental health, right? You're helping others have the chance to come across one of my videos and learn everything they need to know about dental health information, because we all deserve access to care, and I'm doing all that I can to at least provide accurate information out there, and then one step at a time, we'll try and bring more awareness and more access to care out there. What is this one? Oh my gosh, Patsy, thank you. This donation is very nice. What has been the most rewarding part of developing the Teeth Talk community? that right there, saying that where do I even start? Having this community that allows me to be myself. I do this presentation so I have 3 presentations when I speak. One is all about dental health misinformation, combating misinformation, effective communication techniques with your patients, blah, 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 blah. That's mostly for dental professionals. I have another one for dental students, and it's all about my story and like how I started on social media and kind of inspiring students that there's more to dental hygiene than just clinic if you want more. And then the third one I have is I talk all about being yourself. And as a healthcare provider, it's not a one size fits all and blah, 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 blah. My point is, when you bring this up, I have so many slides that talk about the community that we have here and how this community keeps me going. And you all remind me to be my authentic self. And I have a slide in there that shows like in this day and age, especially on TikTok and Instagram, I mean, on YouTube Shorts too, where it's like trending audio or trending dance moves or whatever the case. In this day and age with all that trending stuff, it's on social media, it's very hard to be yourself, right? To be your unique, authentic self, because we're all just kind of copying TikTok dances, right? Again, not bashing it. I think that stuff's very fun. But when someone is new and trying to like be themselves here, it's hard. My point is, that's been the most rewarding part of developing the Teeth Talk community, is that you all inspire me and motivate me and allow me to be who I am. And I got no more words, but thank you. Uh-oh, what's this? Uh-oh, those aren't coming through. What do I do with that? I don't know. Uh-oh, did my internet stop? No, we're here. We still have a few more minutes, right? For some reason, everything on my computer isn't working. But I'm on my phone. It's just, so when I'm on my phone, I'm talking to you, but on my computer, I could read the chat better. Oh my goodness, you're probably like, sick talk girl, not teeth talk girl. Like, no, it's allergies. I've got tested for everything. I'm not sick, it's just allergies. Okay, I literally went to my allergist this morning, and she was like, yeah, the pollen levels are high. You're just struggling with allergies. Okay, I just need to, give me 1 second. We're gonna answer a few more questions. Set. Whoa, Rainbow. My friend Rainbow, you sent 5 Teeth Talk Girl gift memberships? This is so nice. This has happened once before that I remember. Thank you so much. Oh my goodness, I'm gonna take a screenshot. Let's smile. Let's all smile. Did it work? Did my screenshot work? I just wanna thank you on like Instagram. So that means that you just sent, I believe, randomly 5 people in this chat right now get a membership to the YouTube community. Is that right? Oh, my text messages won't open. Whoopsies. Well, okay, I screenshotted that. I'm pretty sure you just did something very nice. Very nice to everyone in here. So what that entails, if you're someone who was selected, please let me know. DM me on Instagram, please. If it just like alerted you that Mr. Rainbow just gave you a gift, please let me know. Mr. Rainbow, please DM me. Let me know how this works because it sounds awesome. Okay, so what I think just happened is Mr. Rainbow just donated memberships to 5 of you in this room right now to be a part of my memberships on YouTube. So it's kind of like Patreon, if you've heard of Patreon, where it's like you pay monthly and you get extra stuff and you get to, of course, support me in making videos and everything like that. And so like there's like different tiers. Like the 1 tier is like quick response to comments. There's another tier where you get like videos behind the scenes and like recaps every month of me making my videos. That there's another tier. Like there's different tiers that you get different things, and the biggest thing you get and give to me is support. So thank you for Mr. Rainbow to indirectly and directly support YouTube, my YouTube channel. That was so nice. Thank you. And yeah, if anyone else wants to be part of our Teeth Talk community, there's like teeth enthusiasts, there's toothy supporter, there's all these toothy community. You can be in all these different tiers, and it's so fun. And I love our little community. It's a small little community, but hey, if you are so passionate and you want to go above and beyond subscribing here, click subscribe if you haven't already. If you want to go up in the community section, come on down. We have a lot of fun. We talk deep into teeth. Thank you. That was so nice of you. Okay. And then, okay. Uh-oh, someone's asking about flossing. Where did it go? Okay. Oh, someone who love when you read comments on IG. They are hilarious. GU. Thank you so much for saying that, because I have a friend, if she's in here, she messaged me and said, Whitney, you have to stop reading those comments because you're vibrating at a low frequency and you should not be like, and I get it. She's looking out for my mental health. She's like, Whitney, you're literally just like, you don't want to get on their level. Like, you have to vibrate at a higher frequency. And I was like, I know, but I will say it gives me some, I don't want to say like therapeutic benefits to reflect on what wild things people say, and then to share it with you all, and then to validate that it's them, not me, because you all help validate that I'm not the one going crazy. You know what I mean? So anyway, I'm so glad when I hear that people enjoy it, because I'm like, is this good or bad for my mental health? I'm not sure, but I'm so happy to know that you all enjoy it, because I think it's good. I really think it's like a therapeutic thing where I love to like poke fun at myself. And anyway, thank you for that feedback, and I will love to hear that feedback from anyone, if anyone hates it or loves it or whatnot. Okay, oh my gosh. Alan, $5. Thank you. Thank you so much for everyone who's supporting and sending these gifts. That's very nice. Oh, we have 118 people right here now. I will say, I know I said I'd finish at 7:30, but I know it's 7:30 my time on the 30. We'll do a few more questions because I just love you all so much. I truly do. And I don't want to say goodbye yet. And I don't know how to get rid of this. Okay. My throat. If your nose is running, go chase it. See, this is why our community is amazing. Y'all get my joke. I love the humor. I love dental humor. I love comedy. I love it all. Hello, I'm getting braces soon. I'm so scared for a canker sore. Logan, no worries. They're going to give you some wax. And if there's any spots that bother you, you could just like put that wax on the wire, and then that area won't hurt you. It takes some getting used to. Popsicles are your friend, right? Like, cold is your friend. Anything you could suck on ice, don't chew on ice. But it's going to be so worth it. Anyone with braces, public service announcement, just make sure you keep your teeth as clean as you can when your braces are on. I know it's annoying to floss them. I know it's annoying to brush them, because technically you have to brush above the brackets and below the brackets. So you almost have to brush twice when you have braces. Every time you brush, you should brush after every meal if you can. Flossing's annoying, I know, but they make a lot of cool floss picks now that you can they go right under. And then also there's water flossers. There's proxy brushes that go through your teeth. Again, if you're struggling flossing with braces, what do you do? Anyone? You type flossing with braces teeth talk girl into YouTube or Google, and my video will come right up. And I have all these, oh my goodness, I'm so sorry. All these videos of mine. Did anyone ever say if they have allergies too? Maybe I need to scroll down and see. All right, let's do 2 more questions. Never change. You're all saying very nice things. Thank you so much. Lady Gaga likes her sushi. Rah, 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 Gaga. Okay, I'm obsessed, Mr. Cade. We really are all the same. This is like my group. Y'all are my people. Obsessed. That's really funny. Hi, I'm a dental assistant. Hello, Lauren. Thank you for being here. I was a dental assistant before dental hygiene, and I love dental assisting. And I'm like, anytime I have time to help in sterilization, I do. Because I remember when I was an assistant and like hygienists would just slap their tray down in sterilization and walk away. I get if you're behind, but like you could be nice and be like, I'm so sorry, I'm really behind. Can you take it? Like, to just slap it down. I remember being like, okay, I took note. I will never do that when I'm a hygienist. I will help when I can. And anyway, I just hope you know that we're all on the same team. What's this cute cat? Oh, look at Ben. Also, I love Ben Pulliam. I love your toothy, your tooth. Look at that. You all see this? Am I making it big? When I make it big, maybe it's only big on my end. Yeah, it's only big on my end. When you're in the membership of the YouTube community, you get like a tooth next to your name, and there's different colors and different designs depending on how long you've been in the Teeth Talk community, which is like the Patreon, right? So that's so fun. I love seeing all the different ones. Excuse me, I shouldn't get too close. Can't be looking at my nose. Hold on, let me look close like this. I said I'd do 2 more. Did I do 2 more? Did you all think I just buffered? Patsy's trying to work out how to gift memberships. That's so nice of you. Me too. I want to learn how this works. Let's see here. Okay. Oh my gosh, Patsy, I think you did it. Patsy just did it too. Sent 5 Teeth Talk Girl gift memberships. Thank you so much. Please, I know I talk with you on DMing. Please let me know like what that entails. Like, do you get to pick who gets them, or are they selected randomly? Do they have to accept? Anyone in the comment, like right now, if you're getting like offered a membership for free, it's fun. It's from people donating it. Click yes, like, and say thank you so much. That is so, to the person who donated it, to be in our community. That is so nice. Thank you. Okay, a couple more questions. Makia asked, should wisdom teeth be pulled if they do not hurt? And the answer is yes and or no. It depends. So the reason wisdom teeth need to get pulled or extracted is if they already hurt, yeah, we need to get them out, right? The goal is to get them out before they hurt. And if a dentist is suggesting to you to get them out, there's a reason. And it's most likely because they know they're going to hurt you at some point. And it's much better and easier for you, for your healing, for so many reasons, to get them pulled before they start hurting. So some reasons they might suggest you to get them pulled is, 1, if they just don't fit in your mouth. If they're too far back there and you literally can't reach to clean them properly at home, then you're going to be at an increased risk of cavities and gum disease, right? Or 2, if you already have dental disease in that area, if you already have cavities or gum disease in that area, we need to take them out, because now there's going to be an infection, and we all know dental tooth infections can spread, and think your brain's right there. You don't want that infection to spread there. You don't want it to spread into your bloodstream. So yes, if you're being told to get your wisdom teeth pulled, it's for a reason. It's not just for funsies. So I hope that kind of helps. And then our last question. Oh my gosh, Bright Bob. We'll do 2 more. What's your favorite YouTube video you've made so far? All of them. No, I'm just kidding. I will say my parodies. I have so much fun with the parodies. I haven't done one in a very long time, so that's why I'm like, I cannot wait to do the abracadabra one. I'm so excited, but I have like a short time limit to make it, but it's gonna be great because I know I have all y'all's energy on my side. I'm so excited. I love the parodies. Having said that, that's just fun for me because of course I'm like really into acting and I love like theater and like all that stuff. But my favorite ones that I make are the ones that get the most views. Good reason behind it, because then I know I've helped that many people learn about dental health. You know what I mean? Like the views, like it's not like, oh my God, so many people are watching. It's like, oh my goodness, so many people are learning about dental health. That makes me very happy. So when it's a video that hits and people are like clicking it, those are my favorite because I'm like, yes, it worked. I'm getting through. It's probably like I'm not a parent, but like if you have kids and you're like getting through to them, you're like, wow, something I said got through to them and they're finally doing X, Y, or Z. It's that feeling of like, I got through to people. So I hope that answered your question. And then like one more. Oh my goodness, wait. If Lady Gaga had a child, she would call it Goo Goo. Gaga Goo Goo. I can't. You guys, all I took was an Allegra, and I'm feeling like out of it. I think because we're just all having so much fun. Ugh. Okay. All right. Last question. You ready? What is it going to be? Someone said, can anyone tell me how often these lives happen? That's not a dental question. That's an easy one. I'll answer for you, Charles. Oh, I wish I could tell you. They're usually on my school breaks. So right now I have a week off school. So that's why I'm doing a live. So my next week off school will probably be August. So that will be probably our next live. So it's usually after like a school semester. And then when I'm not in school, I plan to do them every month. That's my goal. But when I'm in school, I'm like losing my mind. So, even though I should probably do this more because you all put me in such a good mood. And like, if I did have to go write a paper right now, I'd be like, I'm ready. I got the Teeth Talk team all up in my veins. Anyway. Okay, let's do a toothy question. Okay. Oh my goodness. Where are we at? I made a wish you would read my comment. I'm glad you read my question. Stop. You are amazing. What are you going to school for? I'm going to school for, what am I going to school for? I'm getting my doctorate in health science right now. And so it's very like public health, policy, healthcare in America, how things work. I'm learning a lot to hopefully be able to create some change to help people gain access to care and to get more people with the education and products that they need and tools that they need, and so many reasons. There's so many reasons, but just know I'm very happy. More and more hygienists are getting this degree because you can really focus and specialize in your section of healthcare. So mine is, of course, dental health, and I'm kind of focusing more on dental public health because I think dental public health is so amazing. Okay. Oh my goodness, someone had such a great I know, I just keep reading them. I keep saying I'm about to finish and then I keep reading them. Someone said, see if some colleagues can join like Dr. Joe. I should. That'd be so fun. Maybe I should do that one day. See if Dr. Joe wants to get up on this. We could share live, or like one of my other dental friends. That's a good idea. I love that. Thank you. I got the wheels turning. Steven just got accepted to dental hygiene school and you're a lefty male. You get it, hygienist, and you're a lefty. I love it. And like most people who aren't in dental, you'd be like, why does it matter if you're right-handed or left-handed? It matters because the chairs are set up for right-handed individuals. And if you're a left-handed clinician, it's a whole thing. You literally have to it depends on the unit, but some units are harder than others to switch everything over for a left-handed clinician. Long story short, congrats, you're going to be fine with the left-handed schools, clinics. Like the schools, they make it really accessible for you. It's once you get into the office, then you got to figure out, when you're working, you got to figure out what unit is going to work best for you. All that aside, congrats for getting in. That's amazing. Represent. Okay. Someone said, okay, this will be our last question. Will removing your tonsils get rid of tonsil stones for good and bad breath? This is Danny Z. So I have a tonsils video, so if you want to learn more after this live, of course, what are you going to do? You're going to type tonsils teeth talk girl or tonsil stones teeth talk girl in Google or YouTube, and it'll pop right up. But my quick recap is, yes, if you get your tonsils out, theoretically, you won't get tonsil stones anymore because where will they attach? However, after you heal, there can be scar tissue. There can be scar tissue after you heal. And there has been reports of people still suffering from tonsil stone type debris in the back of their throat because when their tonsils were removed. Some people have partial tonsils removed too, where they don't get the whole tonsil out. So it just depends on the situation. But in all, if you get your tonsils removed, yes, it should most likely reduce your chances of ever getting tonsil stones again. But always talk with your individual ENT. That's a little bit out of my scope of practice. But what I could tell you about tonsil stones is yes, if you've confirmed you don't have any gum disease, if you confirmed you don't have any cavities, if you've confirmed you clean your tongue well, with a tongue scraper or even the metal spoon from your kitchen, or if you brush your tongue, if you've confirmed that your bad breath is not coming from a dental issue, not coming from your teeth, gums, tongue, or tissues, it's probably coming from your throat. Whether that be post-nasal drip, which I'm experiencing right now, and I could taste something gross from the back of my throat. I hear ya when you're having allergies or you got a cold, you're a little sick, that bad taste in the back of your mouth. Or tonsil stones. Some people have more tonsil tissue and scar tissue from being sick as a kid. If you had strep throat a lot as a kid or you just always sick as a kid, you might have more tissue in the back of your throat where these little debris, pieces of debris and food, they call them tonsil stones, and they get hardened and they're all up in your tonsils. One more minute. Sorry. And so Where was I going with that? It could be tonsil stones, could be postnasal drip, it could be issues from your stomach, your GI, your gut. It could be all these different things. So if you're ever struggling with bad breath and you've ruled out all the dental issues, definitely go see your primary care physician, see your doctor. They'll refer you to a GI doctor if needed. They'll refer you to an allergist if needed. They'll refer you to an ENT once they kind of have a hunch on what can be going on, right? You rule all the things out. That's kind of how like medicine and healthcare works. You rule everything out that you can to find what it might be. It's the best way. It's the most conservative way, right? Than treating you for things that you're not sure it's the reason you're having the issue yet. So anyway, I hope this helped you. We almost made it an hour. I said I'd only do a half hour because I'm like choking on my postnasal drip. But I just think you all are all so amazing, and I'm just so happy to be here. And we went longer than I planned. And what am I pressing? Thank you again to everyone who donated the gift memberships. Please let me know how that works out. I would love to know like who gets them, if you get to choose. And thank you to everyone who's in the membership as it is. Thank you to everyone who follows me on Instagram. Please, at Teeth Talk Girl. Hang out with me on Instagram. Hang out with me. We have the job board if anyone's looking for dental hygiene or any type of dental jobs, jobs.teethtalkgirl.com. We have my regular website, teethtalkgirl.com. You know where to find me. Thank you all for being here. Keep spreading toothy awareness. Keep spreading kindness. Keep being nice to one another. And thank you for listening. And I can't wait till the next live we do. It'll probably be in August, but you never know if the summer semester isn't too horrible. If I'm not too overwhelmed, maybe I'll add one in the summer because I love doing these so much. Peace, love, and teeth. Thank you so much for being here. Thank you, thank you, thank you.